Exhale all the way out. Good. Good. Relax your shoulder. There it is. Exhale. Okay. Face down again. Okay, I got Matthew in the office. Matthew, what's bothering you today?
My neck and my shoulder.
Your neck, your right shoulder?
Yes.
Any pain down your right arm?
A little bit, yes.
A little bit. You get any headaches?
Yes.
Okay. Pain through your shoulder blades?
Yes.
Okay. Anything to the left?
Yes.
Okay, so all upper back, shoulders, between the blades, and neck.
Yes.
Okay. How long has this been going on now?
For a long time.
When did it get worse recently?
About 3 days ago.
Okay. Yeah, so this is the second visit. He's come back in. So he's had this issue on and off, now came back. So we're gonna go over the treatment, the adjustment that we do for something like this super common problem. I'm sure many people watching. Pain between the shoulder blades, pain tops of the shoulders, headache, neck pain, tension. Okay, slide down, push your feet, Matthew, a little bit. So I'm gonna give soft tissue work on the shoulders, obviously. We're gonna just, a lot of knots and inflammation and stress that builds up in your shoulders. So we just kind of put pressure into there. Is right worse than the left, or is it both?
It's both.
So right here I'm on is where this is the superior medial border of his scapula. Right there where these muscles attach. So his levator scap attaches here. It originates right here and then runs up into his neck. So we get on those attachment points. Then the superior border of his scap is where this trap muscle attaches and there's rhomboids. So just on those attachment points around his scapula. Again, we try to do a little soft tissue for all the patients that come in, not just adjust them, but just targeted to where their specific problem is. Take a nice deep breath in, Matthew. Exhale all the way out. Good. Good. You adjust better face up anyway. Okay, go on your back for me. Slide down toward your window. Deep breath. Exhale all the way back. Good. One more. There you go. Nice, easy neck adjustment. Just relax your shoulder. There it is. And this way, nice and light, Matthew, all the way out. Perfect. Go on your side facing me. Deep breath. Exhale. Other side. How's your lower back then? Pretty good. Exhale. Okay. Face down again. So his neck moved great, his low back moved great, but his upper back is really locked up. Slide down. So instead of really trying to adjust through all that spasm, we're going to do some light drop table work. So just with a light pressure, I can get a good adjustment in because the table is doing all the work. Very comfortable for the patient. He's relaxed. So anybody who doesn't like all the popping and cracking, if you will, this drop table is good for that because it is none of that, but it still has the same effect, the exact same effect as a regular adjustment. So again, he's so tight through here. None of that's budging today, but drop table work is a great tool. Again, we're trying to stimulate movement. We're trying to stimulate what are called mechanoreception and proprioception in those joints. Activate those movement receptors, which are almost, think of them as like healing growth receptors. And we want to, as you move those vertebrae and get the range of motion back, there's less nociception, which is the pain and inflammatory signals coming from those joints. So that's why movement is key. That's why exercise and stretching is so important. Chiropractic essentially is movement, but on a segmental level. There's certain joints that are very restricted, that are very tight, that are really causing the problem. And What chiropractic does is it moves those joints through their proper range of motion, breaking up scar tissue, breaking up adhesions, and restoring those normal mechanoreceptor input coming from those joints. Mechanoreceptors feed into your central nervous system, so chiropractic is good for other things, not just back pain. People sleep better, people's immune system's better. That's all documented with studies. That comes from better proprioceptive and mechanoreceptive input coming from a healthy spine. You have a lot of stress in your life, a lot of old injuries, a lot of wear and tear, it could be anything. Your spine has lots of nociception coming from the joints. We want to restore the proper mechanoreception and proprioception. Again, that's a little different than pain relief. We're treating him for pain relief, but that's an added benefit of getting adjusted. Is the overall effect on your overall health. Tender there at all?
Yes.
So he's super tender in his traps. He holds a lot of tension in his traps. So we're just getting like a little extra pressure in through there. Some patients can tolerate that. Some that can't, we're just lighter. We adjust our techniques to suit the patient. Whatever suits the patient best is what we do in the office. It's patient-centered care. He's got a lot of tension in his shoulders. All right, Matthew, come on. Let's adjust your shoulders and you're done. Okay, so just this basic shoulder adjustment. Let this arm relax for me. Anything else bothering you?
No.
Let your shoulders relax for me. Feel wanting to go home and ice. Help break down some of that inflammation. Thank you.